welcome to our Monday Minute. Today we're going to discuss an update to the VBID model, the Value-Based Insurance Design Model, that is a voluntary program where Medicare Advantage organizations file an application and go through a process of bidding to participate in this demonstration. The demonstration includes that as of January 2021, the hospice benefit has been included in the VBID model. So for the organizations who have benefit packages participating in the VBID model, the hospice benefit is included. So if a hospice admits one of their patients, the billing process would be that you would bill both the Medicare Advantage organization and traditional Medicare, and the Medicare Advantage organization would pay the claim. There are many details that we have discussed over the last few years that were inclusive of Monday Minutes as well as blogs and webinars that give you more of the detail of how this VBID model works. So you might want to look at those as well. The National Association for Home Care and Hospice has continued to keep us updated. So we're here today because the demonstration through 2025 has now been extended to 2030. There, at this point, has not been any significant changes to the current model and what's included in the model, but there is an understanding that there will be more scrutiny, outcome measures calculated, etc., as we continue through this demonstration to ensure that patients are receiving the ultimate in hospice care. The concern that most have is that the demonstration inclusive of hospice has been a rocky road so far. As we are shortly into 2023, the third year of the demonstration, there has been concern on both the behalf of the Medicare Advantage organizations as well as the hospices themselves, as is documented in the first annual report from the hospice participation in the demonstration. In addition, it is very concerning that they have extended this to 2030 because of the detail possibility that hospice will become a permanent part of the Medicare Advantage plans. It is imperative that any hospice that desires to continue to be a viable hospice in the Medicare world begin immediately to determine what the Medicare Advantage situation could do for you, how it could impact your hospice if this does become a permanent situation. There are some states in our country that do not currently have a participating Medicare Advantage organization participating package in the VBID model even into the third year of this demonstration. But the reality is, if this becomes a permanent situation, then hospices will be impacted across the nation. One of the things I encourage you to do immediately, if you are going to continue as a hospice in this country, is look at your current patient census, go through an eligibility verification for those patients, and determine if this were a permanent situation where hospice is involved in Medicare Advantage ongoing. How many of your patients are currently in a Medicare Advantage plan? I dare say you are likely going to find that in states where Medicare Advantage is prominent, even though it may not be directly impacting you at the moment, you will find that over 50% of your hospice census has a Medicare Advantage plan. If that were to be the case, then you understand the significance of my concern and should be at the table with the Medicare Advantage organizations in your area immediately. That basically means getting in meetings with them and making them aware of your presence, making them aware of your interest in becoming an in-network provider of their Medicare Advantage plans when hospice becomes a part of their packages. It is different, as I'm sure you can imagine, how in-network versus out-of-network providers are not only paid, but how they are treated as far as the requirements for you getting the payments that you deserve. You really need to consider immediate conversation, immediate meetings at the table with these Medicare Advantage organizations. If you are a current Medicare certified hospice and do not currently have contracts with Medicare Advantage organizations in your area. If you are a hospice that's related to a home health agency, a SNF, a hospital, where those facilities already have contracts with Medicare Advantage organizations, that should be your foot in the door. And we strongly encourage you to begin those conversations. I want to thank you all for participating today. If Healthcare Provider Solutions can ever help you in any way, please don't hesitate to reach out. Have a great week.